The local aim and clinical objective was to actually provide information, feedback on what they do and how they provide services to patients. When a patient actually goes, when a member of staff goes to see the patient in the field, they'll complete a clinical report form, they'll complete that and they'll send it off. They won't necessarily get any actual outcomes on what they've done to the patient. The clinical dashboard is a way of giving feedback to the crews that actually provide this care as to what they've actually done and their outcomes. One of the areas we actually used as a clinical measure was actually measuring the taking of a stroke test, fast test. Crews will go to a patient that's recorded a stroke, comes through as a call taker for stroke. When they arrive there, we need to make sure that a fast test is undertaken to assess whether the patient is a stroke patient or not. And the actual reflection of that as a clinical metric on the dashboard gives us an indication and also an awareness to the staff that it is something that's serious and needs to actually be undertaken and reported on. The clinical dashboard will help generate. And the main things that is, for example, the hospital turnaround time, ambulance at hospital and the turnaround times there. If we can have a real-time information as to saying that this hospital has got a lot of ambulances there and they're being stacked up, and therefore those ambulances, if they're held at hospital, they can't be out responding and saving lives. So, and the corollary for that would be that if you needed to put additional resources to make up for the ambulances that are being held at hospital, it will cost you more money. So if you can free the resources that you have got, then that in effect is like a notional cash release and saving, but that will come from various different factors as well as just the clinical dashboard. The clinical dashboard pilot study is at its early stages yet, so yes, we're still going through a process of evaluation, but the initial indicators are that it is proving it's a useful tool, and we will be looking to actually extend the use of clinical dashboards across the organisation. Naturally, it gives us an ability, a platform to provide feedback to members of staff in the stations, the 63, 64 stations across South East Coast Ambulance Service, about how they're actually performing in terms of key clinical indicators. And it's raising the awareness of that amongst members of staff, giving them feedback that they can actually see what they're doing, see how they're performing and improve that performance. It also neatly fits in because clinical dashboard is like a top level tool of the organisation. Underneath that, we're developing team-based reporting, which will focus on these key clinical indicators that have been identified in the dashboard and be able to feed back down to lower team levels and individual members. The intention will be in the future to actually expand the use of clinical dashboards to target them, or if you like, tailor them to specific geographical areas. So it's not just a whole CCAM-wide service, it's relative to a service, say, for providers of the ambulance crews in East Kent or in Surrey or down in Chichester way, so they can get a direct feedback of what they're doing and how they're providing care for the patients.